Hey Doc, it's Nick. This is a case we're looking to work on together and just wanted to share my thoughts. This is a patient who presented who wanted to straighten their teeth. Not surprising here based upon the crowding. Pretty obvious left side posterior crossbite, exaggerated overjet in the anterior, obviously an aesthetic compromise. With that said, the midlines are coincident, canine class 1, molar class 1. Somewhat molar class 3 here, although if we close these spaces here, we can imagine that the molar relationship would be more class 1. Um, this side is definitely more class 3 and might have something to do why there's a posterior crossbite here. So we'll call this a molar class, dental class 3. Obviously a CAT scan and or Ceph would help us with the skeletal orientation, but as you can see, the mandible is obviously not class 3 in relation to the maxilla. So this is really a case that should be straightforward. The question is the following, which you had presented in the email. Do we need to expand the palate in order to correct this posterior crossbite? And the answer is maybe. Unilateral posterior crossbites are not the same as bilateral. Bilaterals tend to be the situations where there is a significant maxillary deficiency in a transverse direction in that lateral dimension. But if we take a look, now let's just ask the question, what if we just use Invisalign to straighten these teeth and correct the posterior crossbite? We know that when we expand posteriorly, we decrease the overjet. So just by expanding dentally, we're actually going to improve this anterior relationship in addition to unraveling the crowding on the lower. So it'd be interesting to see what ClinCheck shows us if we create an ideal class 1 overbite, overjet, canine relationship, and molar relationship. My gut tells me that things are going to line up well just by straightening the teeth digitally. Now, he does have some recession here in a couple areas, and I don't know the age of the patient, but he strikes me as somebody who's probably in the first third of his life. The reason I want to evaluate the periodontal condition, if we decide to not do expansion in the maxilla, again, it's a unilateral situation, so expansion might not be the answer, especially where the midlines are coincident, because if we expand over here, we might actually create posterior overjet, which is a new problem as we resolve the posterior crossbite on the left side. That doesn't mean we're going to create a problem, but it's just kind of where my head goes. So if we ask the question, can we do this with Invisalign alone, we want to ask what is the health and the biotype of the posterior periodontium. Obviously, this photo alone isn't going to give us a whole lot of clues, but it does look like he has rather significant, a significant biotype or thick biotype. It also looks like he's got a lot of bone on the outside of these teeth, which means that if we decide to upright the posterior teeth with Invisalign, or let's just call it orthodontics, as opposed to the skeletal expansion with an expander, do we run the risk of having recession of these teeth? So to get some more information, what I did when I was looking at this case is I looked here, look at the occlusal view. And just to get a sense of where these teeth are in the alveolar housing compared to the side that is in proper orientation, I'm just drawing a line from the midline to the palatal surfaces of these teeth on either side. And without a question, there's more palate here than there is here. In addition, there's more, let's come over here, more lateral, how can I say this, inferior to superior aspect or vertical aspect of the palate here compared to here. So there's an obvious asymmetry to the skeletal structure here, which might suggest we want to do some expansion. With that said, from this view, it looks like there's a lot of tissue here. When I say tissue, we're talking about both the bone and the soft tissue. Not to mention, if we straighten this tooth out here, you can imagine that the arch form is going to continue down this arc here as we close these spaces and idealize the arch form on this side. We're going to get a rather aesthetic result. We're going to get expansion. We're going to create more room for his tongue. I don't know if breathing is a problem for this patient. but I would be curious to see what the CAT scan shows for the bone and soft tissue on this side. If there's a millimeter or more of bone on the root surfaces of these teeth, and there's no periodontal probings deeper than 1.5 millimeters, so we have good gingival biotypes on the buccal surfaces of these teeth, then I might consider just using Invisalign to solve this guy's problem. Would it be safer to do expansion? Yes, without a question. But we run the risk of overexpanding this side, as expanding does not allow us to expand on one side preferentially, although there are methods and techniques. We can have that conversation if you do decide to expand versus just using trays. But I would explore the option through the evaluation of the CAT scan to see if expanding this is possible. When I say expanding, dental expansion versus skeletal expansion. Let me know if that makes any sense. I'm a little concerned based on the fact I see recession, which just gives me a sense of his potential risk for periodontal breakdown due to, I don't want to say periodontal breakdown, but recession as a result of teeth being gently expressed outside of their alveolar housing. If you decide to expand, here's I'm going to share this with you. This is a PowerPoint that I put together that has a lot of different tools and techniques for the fixed MSC expander technique. The video online, I guess I don't have the link here, but if you just type in Dr. Moon MSC into YouTube, there's a 3-hour video that's public that you can watch that goes through the rationale, the science behind this form of expansion. I am a huge fan of this for a variety of reasons. I have several cases coming up that I'll be doing. I'm going to be a patient myself. I would encourage you to watch this, and if you like this idea, let's dive into it more. But in a nutshell, with adults, there's expansion methods that involve fixed appliances. This is the best by far. If the patient doesn't love the surgical aspect, we can have a conversation about the removable appliances. We've had great success with those, but I can tell you that this is going to be better for a multitude of reasons. One, it's fixed, it's much lower profile. We don't have to worry about patient compliance. It's fast, and it gives us bicortical stabilization. It engages the nasal floor. All of the other expansion methodologies do not do what this methodology does. So if the patient has any sort of question in their breathing ability and nasal breathing, this is the answer. Above and beyond, I still think this is the answer for all expansion in adults. For adolescents, I think we can get away with removable expanders from the standpoint that the growth pattern that's working with us, we're riding the wave, not fighting the wave. Here, we need to fight the wave, and this methodology is our best tool to fight the wave. But with adolescents and children, removable expanders might still be more than sufficient. Plenty of tools in the toolbox, as usual. So let me know what your thoughts are. Again, coming back to the case, I feel like this can be solved with Invisalign alone, as long as the patient understands the risk here. With that said, I would love to do an expansion case with you. All right, hope this helps, and keep me posted.